What sort of lens implant can you have during cataract surgery? What we would do is choose a lens which is appropriate to the patient. So we've got access to all the latest technology, all the different types of lenses that are available, but it really depends on the patient's requirements. So if someone is very short-sighted or they're very long-sighted, we can correct that. If they have a lot of astigmatism, so astigmatism is when the eye, instead of being round, it's a more oval-shaped, and this can be corrected optically with a bespoke, specially made lens implant to deal with it. The vast majority of patients like to have good distance vision and then happy to put reading glasses on. Some patients are happy to have one eye set for distance, one eye set for reading, a condition known as monovision. And then if someone is really keen not to be dependent on glasses at all, there is the option of a multifocal lens. And these are very effective at giving good distance, good intermediate and good near vision. So we discuss with the patient the pros and cons of each lens, what's best suited for them and for their lifestyle, and what they want to achieve from the cataract procedure. So one of the advantages of choosing a Grange consultant is that we have the flexibility to offer these procedures and the different types of lenses which may not be available, for example, through the NHS.